So, to my knowledge, there's been no cases in Tennessee or Nashville, but it's going to happen, right? So I think everyone should just be aware. I think we've seen it in Minnesota, New York, California. The way detection works is normal PCR tests that we get for when you're worried about COVID. A certain percentage of those are sequenced by the state, and if those are randomized ones are sequenced for the Omicron, then they'll announce it. But again, I don't think it changes anything, right? It doesn't change what we need to do, which is to get vaccinated, is to use some common sense, wear a mask where you feel you're at higher risks. So in my mind, I just want to highlight, again, doesn't change anything, and we need to keep vaccinating.
A lot of countries, including the United States, have put in travel bans to keep people from coming from other countries that have been known to have it, South Africa, some other African nations. Do travel bans really work? I mean, this thing's spreading all around anyway, so what difference does the travel ban make? That's
a great question. I don't actually know the effectiveness of travel bans. I think, especially places like the World Health Organization have some concerns around it. What really works is knowing that you're affected with COVID quickly. So of rapid tests and access to knowing if you're positive or not fast, then keeping those individuals from entering the country, I think, is really important.
President Biden's making another change for people that are coming into the country or coming back to the country. They're American citizens. They're going to have a negative COVID test to come back in, not 3 days before they come back, but 1 day. That's a pretty quick turnaround, and I think people are going to be concerned whether they can not only get the test done, but can they get the results back that quickly? Is the technology that good, and who's going to pay for that? Because usually to get it expedited costs a lot more money.
Well, I can tell you that here in Tennessee, here in Nashville, the labs that are really good at turning around now, they can give you that 24 hours. I suspect the same technology exists overseas. As far as who's going to pay for it, I think that's a really broad question to be answered. I know just yesterday the President Biden's administration put out that they're going to make rapid tests available, like home over-the-counter tests available to everyone, and then they're going to have insurance pay for that. So that's a really important thing, and that also may qualify.
Do you think the next step on all this might be requiring unvaccinated people not to travel, or if those who do come on have to show a negative COVID test before they come on domestic flights?
I think the best way to be protected is to be vaccinated. And if you're not vaccinated and showing a negative test, is definitely a much easier way to confirm that everyone is less likely to have the virus. So, whether you mandate you have to have vaccinations to travel like Canada has right now. So in Canada, you can't get on a domestic flight unless you're vaccinated. You can't get on a cruise ship in Canada unless you're vaccinated. There's a lot greater sense of comfort in that scenario.
Dr. Alex Jahangir is the chairman of the Metro COVID-19 Task Force. He's our guest on Inside Politics. Back to continue our conversation with the doctor after you watch these messages. Welcome back to Inside Politics. Our guest today is Dr. Alex Jahangir. He's the chair of the Metro Nashville COVID-19 Task Force. We're talking about all the things going on, particularly with the new Omicron variant being talked about spreading across the country. Doctor, just one more question about travel. Should people think about changing their travel plans, particularly airline travel plans, given sort of the uncertainty we've got over the next 2 weeks? If people are going to make changes, they got to make them pretty soon because Christmas is only less than 3 weeks away.
My recommendation for that is no, if you've been vaccinated. Get vaccinated, wear a mask. My family and I have traveled now since my family's been fully vaccinated. I'll wear an N95 mask on the flight. So again, if we follow the precautions we all know about, I don't believe you need to change your plans.
With what's going on, even with the Delta variant continuing here, but now with Omicron as well, is there going to be a greater need for early testing for this? And then will that also mean perhaps more use of these new antibody antiviral treatment pills that are out there? I know some of them are controversial primarily because they're being given to the unvaccinated rather than to the people who are vaccinated if they get it. So is that going to be more likely to be used, and is it going to help because it's a pill form instead of the shot?
So first of all, I think access to rapid tests are critical. I actually bought 2 boxes at one of the local pharmacies a few days ago when I went there to see my kids get fully vaccinated. The moment you have symptoms, you should get vaccinated, you should get your test, and then you should stay at home if you test positive. Now, it also knowing that you're ill faster allows you to access the Regeneron, which is the monoclonal antibodies via IV, as well as these pills now from Merck. Those have been shown to lower the severity of this disease. One thing that is still uncertain, but it's really worrisome to some, is with Omicron coming, the monoclonal antibodies and some of these pills won't be as effective against that. So it is really important to get tested, know you're sick faster, get the monoclonal antibodies if need be, and then stay at home.
Do all viruses like COVID-19 mutate this quickly? I mean, we're continuing to have more and more variants coming out.
All viruses want to mutate so that they survive, period. And so when we as a society make it easier for that virus to survive by having unvaccinated people, then yes, that's what we're going to do. And I'm not just referring to vaccinations here in Nashville or Tennessee, the United States, but worldwide, right? So I think part of this, the reason we're starting to see these mutations predominantly in Africa and in India and other places like that, is there was a much higher unvaccinated rate there. So global vaccine access is critical. What we can do here locally is to get vaccinated, because in the United States we're so fortunate and so blessed to live in a country that has more vaccine doses available to us than we have citizens and residents.
So COVID-19 is not smarter than we are, because it seems to be mutating faster in some cases than we're having to react, and we're doing it. But
I don't think COVID-19 is smarter than us. I think some of us are not being as smart as we should be.
Tennessee is less than 50% fully vaccinated. Some rural counties are still down in the 30 percentile on that. Doesn't that put this state in trouble if for some reason, either because of what's happening this winter, every winter we've had the pandemic, we've had increased cases, or because of the new variant coming in here? Is Tennessee going to be in trouble because our vaccination rate is lower than a lot of other states and below the national average for what the vaccinations are?
So I do worry about our low vaccination rate. Nashville is at 60% fully vaccinated, which is comparable to the national average, and Tennessee is 10 points lower than that. We saw with Delta devastated our state. Hospitals were full, lots of lives were ruined. What I don't know yet is all those people who are unvaccinated who got the Delta virus, do they have some level of natural immunity that now will linger and fight against Omicron? I don't know that yet. But again, everyone should get vaccinated, because that is the most effective way to protect yourself.
Two of the most critical tools that this health department has used, and other health departments across the state, particularly in the larger cities, has been masks and a lot more aggressive marketing of vaccines. The state legislature changed all that. They've taken a lot of those powers away from you and given them back to themselves, or to the State Department of Health, or to the governor. Are you confident that we're going to be okay with these new laws, or are we going to have a problem if things get worse this winter and we don't have any of these things to fall back on to use as ways to fight the virus? So
I think the best way to deliver public health in a municipality is to have those who know what's going on in that municipality take care of it. So local control is really important. I think there are issues very unique to Nashville and Memphis and some of these larger cities that is not the same as is in Hillsborough, Tennessee, right? We were able to quickly respond to not just this pandemic, but a lot of people forget we had a hepatitis A outbreak before this pandemic. And the local health department would go to nightclubs and vaccinate people at midnight, predominantly gay clubs and as well as other locations, because that's where we needed at that time. Local entities know where to go, know what to do, and it does trouble me some if those abilities are not able to be accessed. The governor didn't sign the bill; it went into law anyway without his signature, because he has concerns about some of the powers, whether you're still going to have those powers, the health board, in the non-pandemic areas. Are you concerned this bill was so poorly drafted, nobody's quite sure what you can do and not do as a health board? Does the health board still responsibility under the control of the state, or is it still under the control of the mayor and the council? Well, I'm not an attorney, but my understanding is the Metro Public Health Department is under the direction of the metropolitan government, right? So the mayor, the council, the board of health. We have 700 or so employees, a large budget. We take care of so many important aspects, not just pandemic related, right? From WIC to Ryan White to water safety things. As far as I know, the Metropolitan Health Department is still under the authority of the metropolitan government, and I think that's the right place it should be.
So what does Nashville do if things do get bad again? I mean, they're going to look to the health department and the health board and the COVID-19 task force to help, because people are getting sick, or there are a lot of cases out there. Maybe we'll see hospitalizations and deaths go back up again, God forbid. Is there anything you can do given the way the state law has been drafted now?
Well, I'll tell you this. I think the Metropolitan Health Department will do what needs to happen to take care of
even if there's questions
residents
about what you do in terms of its illegality?
Well, I don't think anyone wants to do anything that's illegal, right? But I think what I worry about, here's what I worry about, Pat. We've been able to respond to this pandemic in a very effective way, I think, compared to a lot of other places in the Southeast, frankly, because of the abilities we've had. What I worry about is not just, let's say this virus gets bad in the next few weeks. What about 2 generations from now or 3 generations from now? Something happens and we can't respond as quickly, and people don't have lost the history of how we got there.
Dr. Alex Jahangir is our guest on Inside Politics. He's the chair of the Metro COVID-19 Task Force. We're talking about all the developments going on around the pandemic. Back to continue our conversation on the other side of this break. Welcome back to Inside Politics. Our guest today, Dr. Alex Jahangir, the chair of the Metro COVID-19 Task Force. We're talking about the latest developments in the pandemic. Doctor, the city's had a study done. Dr. Bill Frist was involved in it, former senator. We've also had some outside experts involved. They praise what Metro has done with this for all the things that the state has now taken all the powers away from you. That must be kind of frustrating for you, that the things that you seem to have done best, that the experts say, you can't do that anymore. Did you make somebody mad? Are these changes on the state level kind of revenge?
Well, I'd leave that up to the people who made the law. I don't know if revenge is the right word. But I think here's what it is that report and what we've seen beforehand, we were effective in what we've done as far as the response. And again, as I say, I think we should take ownership of the fact that the responsibility of government is to protect its residents. We as a city have done that, and I think the state leaders need to continue remembering that moving forward.
In terms of vaccinations, particularly here in Davidson County, how are we doing in getting children? A lot of those vaccines have come on for children ages 5 and up over the last couple of weeks and months. Are we doing pretty well? Are we seeing that first surge going out there, and then like everything else on the vaccinations, it just kind of flattens out or goes down?
Sadly, we're not seeing as big of a surge as we did when the adults happened. I had my 3 kids fully vaccinated last weekend, and what a day that was for my wife and me. But only, I think, less than 20% of kids in that age range right now have currently been vaccinated. We need to do more. And I understand the concerns, and I think it's really important for parents to really evaluate it, talk to their healthcare provider, and really get the information and make the right decision.
In terms of other communicable diseases, are we seeing people taking up and getting the flu vaccine this year? And is the flu season going to be as mild as it was last year? Or perhaps because there'll be less masks out there, there'll be more spread, and we're going to have a tougher flu strain out there?
I don't know the exact flu vaccine uptake this year, but I will tell you the flu season appears to be getting a little more aggressive than last year. Already we're starting to see pretty increased rates of influenza in several colleges around here in UT Knoxville. And so I worry this year may be a worse flu season than before, maybe a combination of less mitigation techniques, but also maybe the vaccine's efficacy is less than it should be.
You're not directly involved in this, but we've seen reports from a lot of physicians that people have canceled or put off procedures, put off things that they needed to go see the doctor about or keep up their appointments. Are you seeing that's changing a little bit? Have people now felt good enough about, well, it doesn't seem like the virus is as bad, I'll go ahead and make that doctor's appointment and show up?
Yeah, so I am directly involved. I mean, I just came from surgery to this meeting right here, right? I see a lot of patients daily. I've seen it within my medical center and my colleagues. People are getting the care they need. There is some pent-up care. And so hospitals and health systems have done such a great job at minimizing the risk of this.
It doesn't look like the national level to have these vaccine mandates is going to work. The president's being stopped in some of the courts here in Tennessee. A loophole in the state law that would have allowed some businesses to also get out and be able to still have mandates. Is mandates just not, for vaccines just not going to happen? Is that off the board at least anytime soon?
That's a hard question for me to answer. I think there have been, as you know, the legal challenges and so forth. It is very hard as a business owner, right, to have to navigate thinking you have to mandate one day and then the next day not having to, and then maybe worrying about having to go back. I think some clarity would be really helpful for businesses of all sizes, and so I hope that our elected officials and judicial system figure that out sooner than later.
So I guess the question is, if we get down to our last couple of minutes, first, is COVID-19 ever going away, or is it going to get to a point where it's not the pandemic that it is right now? And as we go into these next 2 weeks, we're not quite sure what the heck's going to happen with the new variant and the other things that are going into the winter season. What's your advice to the public about what they should do to be ready? Is it every man, woman, and child for themselves?
Well, I think COVID-19 will probably go to an endemic thing, kind of like the flu. Like you'll have good seasons, bad seasons. I hate to say every man and child and woman for him or herself, right? I think as a society, as a community, we've given the opportunity for everyone to take care of themselves, right? To be vaccinated. There's now our health systems have done so much. I think the healthcare systems, our teachers, so many people have done so much for this pandemic. I think we need to bring back some level of civility. We need to encourage everyone to take care of each other. I think we've lost that. I've seen that erode in the nearly 2 years I've been in this role. That bothers me. And so, yes, I can selfishly say my family is not taken care of because, my immediate family and then my outside circle has all been vaccinated, and we minimize our risk. But that shouldn't be just about me. Everyone should take care of each other, and we need to encourage that civility.
Dr. Jahangir, thank you so much for coming on the show. Thank you for your service to the community, and good luck as we go into these uncertain times, particularly the next couple of weeks.
Thank you.
And thank you for joining us on Inside Politics. Hope you'll be back here again for a future show. If you can't get enough politics in the meantime, you can go to the News Channel 5 website. You'll find my Capitol View commentary there. There's new commentary posted every Friday afternoon. Enjoy the rest of your weekend, and we'll see you here next time. Goodbye.